much motion do you have in this foot? Can you bend it back and forth? That's fine.
Everything's good.
Is it okay if I touch?
Yeah.
Is it hurt right now?
It always hurts.
It always hurts.
I mean, the
Okay.
closer you get to it,
The more it hurts. Does it ever drain a lot of fluid?
Yeah.
I always went into medicine wanting to take care of the poor and underserved. That was always my focus. Who we see are mainly folks who are either frankly street homeless, often sleeping outside, such as on the Springwater corridor, or folks who are very poor, maybe living in families or in houses with more than the appropriate number of people. So we see people who have significant housing instability or who are actually sleeping outside.
We are going to look at ordering one of the 3 novel medications that are called dabigatran, apixaban, and rivaroxaban. We're going to look and see if we can get any of those directly from the manufacturers, because you don't have to have insurance for that. And so Rivarox.
Let's go with that one.
Yeah, I like it. It's a good name, isn't it?
Living on the streets is really dangerous. It's tough. There's a lot of factors that impair people's ability to take care of chronic disease. There's a very high risk of trauma compared to age-matched controls. There are a lot of things that threaten people's lives. People have a degree of vulnerability that other folks don't. The last time I did a review on life expectancy for a homeless person, there was a study out of Boston that had looked at death statistics from 6 large cities around the country, and they came up with an expected life expectancy for a chronically homeless adult of between about 42 and 46 years old. Since I started here in 2005, I've kept a list of all my patients that have passed. I have lost 35 patients since 2005, and their average age is 46.
I've been to doctors from California to Michigan and seen specialists after specialists after specialists, and they all pretty much treat me like a guinea pig. Let's try this and let's try that and see if this will work, see if that'll work, and I know what's worked for me over the years and I know it hasn't, and I just stick with those things I have.
Before the van came here 9 years ago, what I've heard anecdotally from patients was that they visited the emergency room for most of their primary care needs. The emergency room is fantastic at dealing with emergencies. If you need management of your diabetes, the emergency room really isn't set up to do that well. So the things that we saw that were largely under-addressed for folks going to the emergency room were chronic health conditions like seizures, diabetes, high blood pressure, heart disease.
You feel his finger how tight it is.
It is tight. This is open, but it actually looks a little better to me.
Yeah,
it's not as dark.
Look. Okay, put a Band-Aid over, it's okay. But see, when you leave it open, air gets through and it can heal up better. See, it's not different. I like that.
If I had to give the general population one message about homeless people, it's that they're not very different from you and I. The differences are in resources and in opportunity and in sort of the cards that life has dealt them. But in general, homeless people are very much like everybody else. I really believe, after doing this for 9 years, that the thing that we do that makes the biggest difference for people is to see them and to treat them respectfully. That's what I hear back from people is the most important thing, more than what medications we prescribe or more than making sure that they get referrals lined up. They can come here and feel like actual people who are in a professional relationship with a clinic and are treated well despite their social status.